share this data. Brilliant. Thank you very much.
Perfect. Thank you, Holly. I think just to reiterate what Holly said about the conference, it's actually a really lovely conference. I attended this in 2019, which is actually the way I found out about this lovely group. I especially really like the pre-conference workshop, so I definitely do recommend attending for everyone. And I saw recently that UCL and QHRN have 5 free conference places, which I thought was just so wonderful. So yeah, everyone, please do have a look. So thank you, Holly, for introducing me. As she said, my name is Lakshmi. I'm going to just present some findings from my PhD research. Just a bit about myself. I just finished a PhD at the University of Edinburgh, where, of course, I looked at adolescents' perceptions of the ICAST-C. I recently started as a postdoc at the Department of Psychiatry here in Oxford, where I'll be working on engaging young people and figuring out active ingredients to preventing depression and anxiety among young people in different parts of the world. So yeah, I think I'll just jump right into the topic. So my research so far has been a lot on violence against children, and I've been particularly very interested in how we could measure this better. And I originally became interested in this topic because it's actually very difficult to kind of get rigorous and comparable data on violence. As you can imagine, it's quite a hidden phenomenon and difficult to measure. So anytime you have 2 different data sources, it's very hard to actually compare them because they've used either different timescales, different definitions, or different designs. And so it's really quite a tricky endeavor. And apart from this, there are also various like data sources that you can use to measure violence against children. You have kind of representative population-based surveys, which use self-report measures, which are usually the sources that are kind of most free from bias in terms of their ability to give accurate estimates. You also have administrative data sources that are, collected by agencies, but they're usually subject to quite a lot of underreporting, so they're not as reliable, although they're quite useful still. And you also have something called sentinel surveys, where you collect data from professionals who work with children and adolescents. But my research really focuses particularly on the psychometric properties of self-report measures on violence against children. We're actually doing a Cosman review at the moment, which actually is close to being published, but or close to submitting it anyway. But there are essentially huge numbers of like self-report measures that are out there. They either look at very broad constructs like violence against children, or they look at trauma more broadly, or they look at particular aspects of violence against children like child maltreatment, or even specific types of abuse or neglect, like particularly just sexual abuse or neglect or emotional abuse, something like that. But when you look at one common theme across a lot of these measures is that a lot of this current psychometric evidence has focused a lot on properties like structural validity, internal consistency, and reliability, which are measured using kind of quantitative methods. And they're all very important dimensions to measure, but there's actually very little evidence on the content validity of measures. Now, what I mean by content validity is really how the target population that is intended for the measure to be used with, what they think about how relevant the measure is, how comprehensible it is, and how comprehensive it is. It's really, when you think about it, kind of a base psychometric property that informs many of these other properties, but there's just actually very little research on this particular aspect. So this was a question that I was really hoping to answer in my doctoral research. So I looked at one particular measure called the ICAST-C. It's quite a good measure. It's a rigorous measure. It's been field tested, and it's being used more and more in lots of different studies. So I thought this was a good measure to test. And I particularly wanted to test this with adolescents over the age of 11, since that's the target population, since they are the target population. So essentially, I wanted to look at how adolescents really perceive the ICAST-C, but also what is the content validity of the ICAST-C. And I really wanted to test 2 particular properties of content validity, which is its relevance and comprehensibility. I also wanted to understand adolescents' broader experiences of answering this measure. And I really wanted to generate like a revised version of this ICAST-C where I could integrate all these perspectives and generate some good recommendations for using this measure. so that it is more relevant and acceptable and comprehensible to adolescents who it's meant to be used with. And so when I went about planning the study, I really wanted to have a comparative element because, and I think we all know this, is that violence against children, again, can be very culturally specific, is that what's abusive in one context may not necessarily be perceived as abusive in another context. Although, which is why measures now don't ask someone whether they've been abused, but ask whether they've experienced certain behaviors. This is again a step in the direction so that we could compare the frequency of behaviors as opposed to asking participants to make subjective assessments of whether they've been abused or not. So essentially, I wanted to understand how adolescents in different contexts might actually perceive this measure. So I did the study in Romania, South Africa, and the Philippines. And I did this because you might be wondering why these three contexts. It may appear fairly random. So there are some reasons why I decided to choose these contexts. One reason was that I wanted to do this fieldwork in quite different cultural contexts, like, Eastern Europe, Southern Africa, and East Asia were all quite different regions. And all of these countries are also quite distinct and different within these areas. Another reason was that I really wanted to understand how, if adolescents had answered the ICAST in the past, whether their opinions might differ from adolescents who'd never seen the ICAST before. So I kind of conceptualized this as research exposed and non-research exposed participants. And so I had to kind of find contexts where there were young people who had answered the ICAST in the past as part of a previous study. So part of the study also involved tracking down adolescents between 10 to 17 years of age who were research exposed, but also finding adolescents who were not research exposed. So in Romania, South Africa, and the Philippines, all of these countries did have studies where the ICAST had been used. Ultimately, it did turn out that in Romania, I couldn't actually track down the research exposed participants because the previous sample was fully anonymized. So there was just no way of really tracking those young people down. But this was possible in the Philippines and South Africa. In terms of methods, I went through quite a methods journey trying to find the best methods that I could use to kind of elicit these experiences and these perceptions. And eventually settled on something called a cognitive interview. This is not the cognitive interview that we refer to in forensic psychology, which is a little bit different. But what I mean here is a cognitive interview that's used in the field of cognitive aspects of survey design. It's really a field that recognizes that answering a survey question is not really an input-output simple process. There are many internal processes and sort of complexity involved in answering these questions, relating to how easy it is to comprehend the measure, how participants might interpret these questions, how they might recall behaviors, and then make a judgment as to which behaviors they need to then draw on to answer these questions, how to choose between these different options that are presented to them. So this method of cognitive interviewing really really draws upon this field quite heavily and uses a lot of particular techniques to elicit these insights. So the most commonly used techniques are something called think aloud and verbal probing. Think aloud is when you encourage a participant to think and talk about their process of answering the question as they're answering it. And I'll delve into this a little bit more later, but this is a very common technique used in cognitive interviewing. And another technique is called verbal probing, where you have lots of specific probes to get participants to talk about what they think the question meant, what time periods they had in mind, how they might have arrived at the answer, things like that. And so and in addition to cognitive interviews, I also thought it would be really nice to have a more creative element to understand adolescents' perceptions of this measure. So to this end, I used a lot of emoji stickers and colors and drawings with adolescents to get them to express their views in other ways that didn't involve talking to an interviewer. So these were really the methods I used. And I used template analysis to analyze the data. It's really a variant of thematic analysis, but it uses lots of hierarchical coding and like developing templates successively as you progressively analyze the data. And since I had like a sort of a staggered approach to the data collection where, yeah, as you can imagine, doing this fieldwork in 3 contexts took some time. So it took me a year to cover all 3 contexts. But I could kind of start analyzing the data as soon as, one context was kind of completed. So, I would develop templates and kind of look at it and then compare it to what we were finding in other places as well. And so I'll be talking about the ICAST a lot, so I thought it'd be good to have a visual of how it looks. So this is the part really where the questions begin. But before this, there's a little bit of kind of introduction talking about, just how children are exposed to violence and what the ICAST really seeks to ask about. And as you can see, it really asks about the behaviors in the left column. And then at the top in the rows, there are different ways to mark the frequency or whether that behavior happened at all. So you could mark down the frequency of how many times it happened in the past year, or you could say you had experienced it in your lifetime, but hadn't happened in the past year. Or you could say you never experienced it, or you could say, you could have no answer if you didn't want to answer the question. And then if that obviously applied, then you would also mark down the perpetrator in the B questions. So you could choose really more than one option in the perpetrators because you could have experienced this with multiple people. And in this sense, since it covers both adults and other children, so it covers, peer victimization as well as violence that could have been perpetrated, not just by adults in the home, but outside the home as well. So essentially it has about 40 minutes. It has, the ICAST-C has questions on physical abuse, emotional abuse, sexual abuse and neglect, as well as a few items on witnessing domestic violence and exposure to community violence. I just slightly shortened the ICAST. I just removed a few repetitive items so that it was just a little bit easier to test and for participants to complete. But it takes about 15 to 20 minutes to complete. And I should also say this is not the only version of the ICAST. There's an ICAST-R, which you can use with young adults. There's an ICAST-P you can use with caregivers. And we also have now, we're developing an ICAST short form where you could just briefly use it in a very, in a large survey, really. So in terms of a typical interview, this is kind of how it go. And I should say at this point that I don't speak all of the languages that were spoken in these contexts. So I hired and trained research assistants who conducted these interviews. I also conducted several myself in South Africa where participants spoke English. But I was there for the entirety of the field work, trying to kind of observe and take notes and do this. And so essentially, I had some decisions to make in terms of how this interview would proceed. So typically in a cognitive interview, you would do it prospectively. And by that, I mean, as the respondent was answering the question, you would encourage them to think aloud and they would do the probing at the same time. So the idea is to keep it really fresh so that as they're kind of answering, you get the most out of the insights you could get. But given the kind of sensitivity of this matter, I think it would have been really quite difficult to ask participants to think out loud as they were answering questions on maybe quite difficult experiences, really. So we decided to use a retrospective approach. By this, I mean, they answered the ICAST fully. And after they were done, we would do the cognitive interview. And this obviously has trade-offs in terms of what they'd be able to remember, but I think it kind of preserved the act of answering a questionnaire. It kept it much more kind of closest to how it would be in an actual survey outside of that. And we also told participants we were happy for them to retain the questionnaire or they could share it with us if they wanted to, but everyone wanted to really share it with us. And so after the cognitive interview was done, we also did this art activity where we kind of went through the ICAST together. They could change it in any way they wanted. And we had a lot of kind of art materials they could draw on for this. And they also had lots of drawing sheets so they could really draw about their experience as well. And then, they obviously got a gift and a certificate, which was quite popular to get the certificate. And that was kind of how it went. This is just some information about the sample in the study. I can come back to this later, but essentially there were about 53 participants across all 3 contexts. And this is kind of the split. And as I said before, there were no research exposed participants in Romania. So all participants there are non-exposed to the ICAST. So I think we got a pretty good split of both younger and older adolescents, and both male and female participants, as well as previous research exposure status. So in terms of findings, I mean, one theme I noticed a lot in the interviews is that when participants were asked, what did you think about this? What did you, think about the ICAST? What was it like? Almost everyone would say, oh, it was totally fine. Of course, there were no problems. But then we would probe much more. And then, all of the issues would be coming out. So it really kind of highlighted how important it is to kind of ask different questions about the same thing, give multiple opportunities for participants to discuss these issues. But it's so this finding here, I'm going to discuss about how clear were the items or the response categories on the ICAST. And of course, everyone said it's completely clear at the start, but that wasn't really the whole story. So I used this previous framework. It's a framework developed by Chevening et al. To conceptualize what we call cognitive validity of, particularly the clarity element. And here, there are 3 stages at which, the clarity could be, impacted. The first is when you're interpreting the item, you're reading and interpreting what it means. And the second is when you're undertaking what is called coherent elaboration, where we think about what behaviors and places we should be thinking about or recalling, really what's relevant for us to answer the question. And the third stage is when we have to put those 2 things together and come up with an internal answer and then fit that with the responses we're giving on the survey. So this is actually a framework that's used quite a lot in education research. And I kind of adapted it and used this in violence research. And actually there hasn't been too many studies or really any studies which have used this kind of framework to understand how we could think about self-report violence measures. So it was a little bit of transferring other, insights from other fields into this. And so when I did this, I found several issues with the clarity of items. So for instance, at the stage of interpreting the item, there were 2 levels at which there could be issues. The first level could be when you're determining the intent of the item and what you think it's really asking about. And here, interestingly, for a lot of participants in the Philippines, especially, they interpreted the sexual abuse items to be asking about sexual activity in general. And I don't think it was very clear to them that it was actually asking about sexually abusive behaviors. And so I think that really kind of impacted their interpretation of what that meant. So clearly we were not clear enough about it on the ICAST. And another stage at which the intent was a problem was when we looked at items on physical abuse and emotional abuse. Actually physical abuse especially, where participants often thought like some questions on whether they were being cursed or they were being kicked, they thought none of these really constituted abusive behaviors. They thought it was quite playful and they weren't really quite sure what the purpose of asking those questions were. And there were interestingly some items on positive parenting behaviors as well, whether someone gave them a reward for behaving well, which was interpreted by some participants to mean that they were quite manipulative behaviors because they couldn't quite fit it with the majority of the questions, which were about very kind of negative behaviors as well. So again, so this was quite interesting. And secondly, regarding the item interpretation, there was, as you can imagine, there were issues interpreting the meaning of the questions themselves, so beyond the intent. So you can see how the items on the ICAST are worded. So it says shouted, yelled, and screamed at you loudly. So the implication is they're really asking, has anyone shouted, yelled, screamed at you loudly? But it was actually quite confusing for participants because so many participants would say, well, who are they asking about? Because it's not written in the question. And I think not just in English, but even because we translated this into other languages. And I think it was actually quite unclear who an item was asking about. So I think that was definitely something that was confusing. And there were also like some behaviors that were just unfamiliar to participants. Like for participants in Romania, there were questions on whether someone had threatened to send ghosts or spirits after you, which is quite common in the South African context, but not so much in Romania, which was quite, unfamiliar. So they were really quite unsure of what that could mean. And there were also specific words and phrases that were confusing. And that could just be that participants may not know what those words mean, but also that maybe some words just don't translate very well into different languages, which is something to keep in mind. And in terms of the second stage, in terms of coherent elaborations, there were again two kinds of levels at which we found issues. So the first one was in elaborating internally on what behaviors could be relevant. So here it was, for a lot of the physical abuse questions, participants, they were, a lot of physical abuse questions ask about specific behaviors, like did someone spank you, and things like that. But they often would like interpret them as much more broadly than what the questions themselves were asking. So participants generally thinking about whether they got hurt, and that was kind of their rubric for answering those questions. And to me, it was really interesting in the context elaborations. This is actually something we suspected might be the case at the start that we really wanted to test. There were a lot of questions on neglect, physical neglect and emotional neglect. And neglect is very tricky because some of it could really overlap with in situations of poverty or financial inability to provide. And I think it was quite the case that a lot of participants did think that a lot of the questions on neglect were asking about situations where caregivers did not had an inability to provide or were in impoverished situations. So that was definitely something they were thinking about in the context elaborations. That was a bit different from what the questions were intended to be asking about. And another interesting finding was that some of the neglect questions ask if someone had made them feel unimportant, or had asked, so that was definitely unimportant. I can't remember the other emotional neglect item, but this is clearly, well, not clearly, but we had intended for this to be asking about kind of emotional neglect by a caregiver. But a lot of young people also thought that this could be referring to situations in schools between friends where some peers had made them feel kind of unimportant, or made them feel sad, which is a little bit different again. So the elaborations they were undertaking were sometimes quite different from what the questions were intended to be asking about. And kind of moving on to the next stage, when we look at how they had to fit those two things together and then come up with an internal answer choice, a lot of participants actually found it quite difficult to interpret that options at the top apply to every question on the page. So they would answer the first one and then they'll go to second one, think, well, where's the second row? Where's the row of options for the second question? So it took them a little bit of time. So the structure is not, completely clear. And second, it was also a little bit, you can see that there are options like saying more than 50 times, 30 to 50 times. And there's a corresponding option below, which is like intended to kind of contextualize the frequency and give a few more options to participants to help them recall better. But I think that was again confusing, and it was a case of having too many options there, so it was a little bit not clear. And participants also sometimes weren't quite sure what they should choose between no answer or never in my life but happened before, and sometimes they just felt that none of the options fit their experiences, because a lot of participants wanted to say that this was just not applicable to me. They wanted to make it very clear that these experiences were not relevant to them, but they really didn't have an option to kind of mark that, apart from saying it never happened to them, which they felt that they didn't really quite fit the experiences. And also very interesting was when I discovered this when I was looking at a lot of the filled in ICAST forms. So you can see that the perpetrator question is kind of a logical follow-up. So if you had experienced something, then you would answer who it had been perpetrated by. But I think it's kind of an implicit follow-up, really. But again, I think it was quite unclear for participants, because sometimes they wouldn't have experienced this behavior, but they would still choose the perpetrator option. Or if they had experiences, they wouldn't choose the perpetrator option. So it was a little bit difficult. And also participants also shared with us, both in the interview, but also they marked it in the ICAST to show that these categories in the perpetrator option, like an adult male or adult female or child or adolescent male, often were not exactly intuitive to them, because they're recalling and thinking, oh, my friend did that to me. And then they have to now match that to child or adolescent male, which is very much a researcher way of kind of categorizing these experiences, but not exactly tailored to the recall that participants might be having. And I also looked at how participants might be recalling or what periods they might be considering. And so if you look at the previous option, it's asking about the frequency in the past year. And actually it turned out that participants weren't often distinguishing between their lifetime experiences and their past year experiences. So sometimes they were marking the frequency options, but for their whole life. So they weren't always thinking about the recall periods that we had thought, or we had wrongly assumed that they would be thinking about. And in the process of recall, again, this was kind of, I tried to see if this framework worked well with this, with our study. And I think 2 stages were quite relevant in like understanding how the process of recall might work. And you can tell kind of integrating findings from what I just talked about, where there could be quite several issues where you could be interpreting the item and storing the item in your working memory, where if participants might be thinking, well, actually neglect is asking about questions of poverty, then they are thinking of different experiences to what we might be thinking that they're thinking of. And another issue was that although the ICAST is asking about physical and emotional abuse that could have happened anywhere, not just in the home, a lot of participants would be thinking that it was asking about behaviors in the home. So, you know, at this stage of recall, there could be kind of, you know, different interpretations or things that were not clear in the ICAST that could lead to different interpretations of what we were thinking. And I think building on from what I said about the response options, at the 3rd stage where participants have to link their response options with the memory and items, I think the frequency options were quite helpful because it allowed them different ways to kind of fit their experiences. But conversely, the perpetrator options were less helpful because they were not intuitive enough to helping them recall these experiences. And I really love this drawing by one of the participants where she says, oh, she remembers it and then she decides whether to be honest. And then she answers the question. And I think this drawing actually kind of encapsulates why this framework by Karabanik et al. Is really quite helpful. It's not exactly tailored for use in violence research, and we could actually perhaps develop and build on this work to develop a more tailored framework, because this kind of framework doesn't take into account the act of answering survey questions on violence is actually an act of deciding whether or not to disclose, which is a little bit different to answering any other survey questionnaire, really. So that's something, you know, in terms of theoretical findings as well. Apart from that, we know that for a lot of children and adolescents who participate in sensitive research topics, there could be sort of temporary feelings of upset, but on the whole, they do find it helpful to talk to someone and to like disclose their experiences. And I think that broadly aligns with what we found. But I was really interested to find like kind of how these emotions might work and what are the phases of emotions that could be really taking place for these participants. And I found that especially for young participants, there was a lot of nervousness and apprehension. You know, it could be due to the fact that they think it's a test or they're not quite sure what it's about. And I realize now that very few people read the information sheets or the introduction page of the questionnaire. So we need to think of different ways to make it clear to participants what this is about and think of more oral ways to explain it. And we did all of that in the study, but I think there was still a little bit of apprehension, and they felt much better after we just spent some time talking about what was going to happen before we, started the study. And this actually, and in the second point, when participants are answering the study, they actually experience quite a lot of fleeting concurrent emotions. And one participant highlighted this really beautifully, where he went through each question and he put an emoji sticker for what he was feeling in that moment as he was answering that question. And I think this kind of calls into question the kind of neat categorizations of sadness is bad and happiness is good that we kind of think of when we conceptualize adolescents' experiences of research, really, because they often experience these quite fluidly and quite quickly. And like sadness could be was often experienced for a lot of participants as sadness for other children who might be going through something like this, or sadness as recalling something they have experienced, but knowing or thinking of those experiences from now being in a position of strength or resilience. And they go through quite a lot. And after this, I think they end the ICAST often feeling kind of okay and relieved. But I think what was really critical to ensuring that this took place was actually having the chance to talk to an interviewer. I mean, we did the interview because we obviously wanted their like perceptions and their opinions on it. But I think I realized later how helpful it was to just have that option to have some space for debriefing. And I think we should that's something we should really do in other large scale surveys on violence was to provide the option of talking to an interviewer or someone really to just do some debriefing and to discuss what the process was like. And I think that was actually very helpful for participants in this study. And I really like this kind of descriptor that I found in another study where one of the participants called it bad then good. and I think that kind of really highlights what this process might be like. And I also really love the drawing one of our participants made, where she's a bit shocked in the beginning and kind of sad in the middle, but on the whole happy after she was able to talk to someone. And apart from that, I also it was really interesting to me how a lot of participants thought that the primary purpose of the ICAST was to enable disclosure and to create awareness among children. Like it's really quite interesting to me as a researcher to think, I think of this as like this measurement exercise, collecting epidemiological data to think the meanings that participants themselves assign to it. And they really like the fact that they were able to recognize and name certain experiences as abusive. And one of their suggestions, which I'll deal with later, was actually to have an information section at the end, which kind of discusses different kinds of violence that children may be going through. And I think viewing this I also looked at kind of stages of disclosure that are typical, for young people who might have been exposed to like abuse or neglect. And I think the act of answering questions on these surveys can actually help with like stage one, which is to kickstart that process of disclosure, to recognize that they may have gone through something that was quite difficult, and then to really talk about that with researchers. And of course, in the study, we like this, actually the back of the certificates that we gave to participants had a list of local resources, and any participant who had disclosed like lifetime abuse or any even like recent experiences of violence was the interviewers talked to each of them, and we decided on which resources would be the most appropriate for them to access. Nobody thankfully was at current risk for harm, but there were some participants who had lifetime kind of experiences of different kinds of violence, and we made sure that they were able to access the right kind of support. And and as I said, I think participants really valued discussing their experiences with an interviewer afterward. And I think this is something we should recognize as best practice for other large-scale studies on violence research going forward. And I think another really important suggestion that came through was participants really appreciated, like our interviewers always like got to know the young people whom they were talking to, and we really made it strong effort to try and do that. And I think participants really thought this should actually be in the question as well. We should ask about more positive experiences and ask more about young people's, sort of dreams, aspirations, their struggles. And it's really interesting to me how often the interviews we would talk about topics that were not really directly related to the ICAST at all. But I think they just found it so helpful to have that space to explore these things. And another finding was that I think the art activities were really quite successful, maybe not among slightly older adolescents, but certainly the 10 to 15-year-old range. They really, really quite enjoyed that element. There's actually a really wonderful paper by Claire Houghton at Edinburgh, where she talks about how, as researchers, we're often concerned with kind of 3 Cs and 3Ds when we do sensitive research, which is, stuff like consent, confidentiality, danger, disclosure, distress. But actually, young people really value kind of what she called 3Es, which was enjoyment, empowerment, and emancipation. And it's a different way to like kind of reconceptualize our ethical applications when we do this kind of research, and that we could really try and make this an enjoyable experience for participants, in addition to thinking of protection concerns and safeguarding concerns. So some of the changes, there were like a huge amount of changes. I created a marked up version of the ICAST with integrating all of the different viewpoints from the interviews, the filled in forms, the emojis, everything. But these are just a little bit of just a smattering of suggestions that I thought were interesting. I think having a localized case study example in the introduction rather than a very generic one was very appreciated. And like I said, an information section at the end to create more awareness and to give more information to young people was also something that they valued. And having questions, positive questions on their participants' interests and aspirations. And we had some participants who recognized that we need to have more questions on experiences of LGBTQ adolescents, as well as abuse that might be occurring on digital platforms, which I don't think the ICAST-C really quite addresses quite yet, but is obviously an important problem. And I think just having some writing space for participants to express what they want to say. Sometimes what you want to say, especially with like a difficult experience, cannot be put into only the different response options. So just having some room to give additional information could be enormously helpful. And I know the point of the ICAST is not to kind of always facilitate the writing experiences, to also collect kind of these epidemiological data really. But it's really, I think, we need to make this also quite acceptable and meaningful for adolescents. So this kind of writing space could be really helpful. And just having more positive questions on the whole, I think, was definitely one suggestion. So there's just some references and just my talk. Thank you. And yeah, open for questions.
Brilliant. Thank you so much. That was a really interesting talk. So huge thank you for that. I'd just like to open the floor to the audience. Does anybody want to raise their hand and ask a question? Or, oh, we've got a question that's just come into the chat. So it says, was the ICAST developed as a standardized outcome measure with associated psychometric properties, or as a tool to prompt discussion, i.e. a more structured interview with opportunities to expand on answers? If the former, will you change the questions on the questionnaire, or will you need to do further psychometric testing?
Thank you for that question. So I can't read the question entirely, but I mean, when Holly read it out, I was thinking to myself, as the former, it was developed as essentially a patient-reported outcome measure to collect this kind of epidemiological data on violence against children. They did do field testing in some countries, and they did do initial psychometric testing, but not this kind of in-depth qualitative testing that might have been really helpful. So I have worked up like a marked up ICAST, and I do plan to develop a revised version of the ICAST-C, which I hope we will then test again for the psychometric properties, so that we can actually take these insights into account and build a better measure for the future. So hope that answers your question.
That's brilliant. And do we have any other questions? Does anyone want to raise their hand? Yeah, we've got one raised hand. Do you want to unmute and ask the question? Thank you.
Sure. That was a really brilliant presentation, and it's really fascinating research, Lakshmi, and very needed, I think. I'm a researcher that is based in Jamaica with the Caribbean Institute for Health Research, and I'm also a visiting research fellow with the Institute of Advanced Studies and here at UCL, and doing some getting to know the colleagues at the Global Center for the Center for Global NCDs. My question relates to something that you said. It wasn't necessarily on one of your slides, but you had mentioned in terms of ethics considerations that you believe, and you cited somebody's work, that enjoyment, empowerment, and emancipation are the key ethics considerations that children and adolescents, and some of these other vulnerable populations, I suspect, are really interested in. And I was wondering if you could speak a little bit about your ideas and thoughts for how to address those needs, which are very much participant and end user focused, and balance those with the very stringent protection related needs that ethics committees tend to have, especially given the topic, because there is the risk of the adolescent revealing something in the interviews that has not been revealed before, etc. So can you speak a little bit about that?
Sure, absolutely. First of all, thank you so much. I'm glad you enjoyed the presentation. I think this is always such like a complex issue when we're doing this kind of sensitive research, really. So the paper I was referring to was by Claire Houghton, and essentially she had generated these findings while conducting quite a lot of like young people's advisory groups, I think in Scotland, with young people who had been or had been exposed to domestic violence or had been situations. So they were definitely, you know, vulnerable young people. And in terms of, I think, ensuring that the 3 E's are respected, I mean, I could tell you in theory, we do need to think about, we could do several things, I think, to enhance that. I mean, we could be taking adolescents' perspectives into account at the analysis stage, and we could be involving them much more in the entire design of the study. We could be making kind of research activities themselves much more enjoyable. We could be ensuring that when we do have the findings, we go back to them, or we are able to facilitate that to ensure that dissemination activities are much more in line with what they want. We produce outputs that are also geared to what young people and more vulnerable people can access. I mean, we could be doing so much, but I think in terms of what could be practically done, I think the kind of discourse with ethics committees is still very much, I mean, understandably, everyone on an ethics committee is focused on protection. But I think but I think and I think to some extent they're certainly right to focus on that. We need well-designed studies. We need to make sure we have all of these safeguards in place. We need distress protocols. We do need disclosure protocols. But I think we can only kind of change that slowly with time, by having just better, like differently designed ethics applications where we also kind of talk through these other elements which are really important to be valued. And to me, like anecdotally, I've spoken to researchers who've had very difficult experiences getting ethics protocols from ethics committees who are very much only focused on protection concerns. But also I've heard like more positive stories where ethics committees are now a bit more open to kind of considering these other considerations. It really seems to vary, and I'm not able to like point out to why or where. So I just think we need to just band together and kind of share resources and slowly try and change this kind of practice with time, is my hope. Yeah, sorry, it's a bit of a rambling answer, but it's a lovely question. Thank you.
That's brilliant. Thank you. And do we have any other questions that anyone wants to raise? Oh, we've got one here. Can I ask how you determine the sample size required for your study? Was it based on saturation within each setting?
Thank you. That's a great question. No, it was not based on saturation within each setting. I explicitly decided not to use data saturation as a factor, just because of many different factors. I feel it's not universally meaningful for all kinds of qualitative research to use that. But I also felt, I mean, pragmatically, planning a multi-country study, I kind of had to know a sample size a bit from the outset because I had to plan so many things around it. But I actually did a bit of a literature review, a brief one, where I looked at a huge number of cognitive interview studies, and I kind of mapped out how many they had looked at to get the best like detailed insights possible. So typically in a cognitive interview study, you would have a sample, you would go to them with the measure, you would do the cognitive interviewing, you'd go back and change it, and then you do this a few times so that you end up with, you have time for several revisions. So, and you would do that with like maybe 12 to 15 people. And that seemed to be kind of the average. So I didn't have the time or the resources to like really do repeated testing, but I thought like 15 would be pretty good in each context. Of course, that was what I decided in theory. In practically it turned out to be a few more than that, because we just had different like practical challenges. In South Africa, we couldn't track down the research exposed participants. Initially, we were eventually able to do them, so we kind of oversampled a bit. So it was a little bit of literature review, bit of pragmatic considerations, and a bit of, I think, what we kind of needed in terms of generating the best kind of insights, really.
Brilliant. And there's another question here as well. I wanted to ask about how participants were able to answer certain questions in some settings, but not in others. I think you mentioned spirits and ghosts that were relevant in South Africa, but not in the other two settings. How did you reconcile these cultural differences in the revised measure?
Sure. So I think in the revised measure, so I should mention that the ICAST-C is not meant to be used as like this very strict and tool with no changes whatsoever. The point is to have a good measure that works across settings, but also has scope for adaptation in each setting. So in the revised measure, for instance, I plan to like put in notes that there are some that seem to be universally meaningful, like someone made you feel embarrassed. That seems pretty common across settings. But in ones where I did find kind of these cultural specificities and kind of differences, that I'm going to make a note that this seems to work in these settings, but not in others. So you may want to pilot this first. And of course, I can't speak to all settings since I only cover 3 contexts, but I will put a note in to that effect.
Brilliant. And while we're waiting for some more questions, I'm just going to ask a question myself. So I was wondering if you could tell us a little bit more about what worked well from your point of view in terms of conducting this research, and what the challenges were as well, because I think all of us have experienced challenges when conducting qualitative research, and you've done research in so many different places. So I wondered if you could kind of touch on that a little bit, if possible.
Sure. I think what, I mean, and not to say that it didn't work well, but I think what was definitely a challenge was the translation. As you can see, like, I think this is actually one of the limitations of the study, is that I essentially translated the ICAST into different languages, and we also translated the interview transcripts into English. So there was certainly meaning that was lost there. And I think certainly translating the ICAST itself was quite a difficult challenge. For instance, in the Philippines, we were trying to like translate this item on neglect, which was asking if, someone, if you were made to wear clothes that were inappropriate for the weather, as kind of measure of physical neglect. And it didn't make any sense there, because the seasons don't really change in the Philippines all that much. So it doesn't actually quite work there at all, as a question of neglect, really. So there were like kind of, definitely issues in translation. And I think that was definitely a challenge. I'm hoping to do a little bit, if we have time later, do a bit of the methods paper and kind of share these kinds of learnings, really. But I think what did work well was that I did develop an interview protocol that was kind of, somewhat fixed, but also scope to modify in each context. And I think on the whole, that actually like worked somewhat well. I think it had a good enough structure that it was able to be modified, but also enough structure to enable comparison of data. But I think, again, what didn't work well in that respect was the think aloud. I think for adolescents, for any of us, it's hard. Thinking is an internal process. For us to think out loud is not very intuitive. And I think that was a technique that we tried a lot, but it just didn't work very well. I think like probing was just much more successful and useful. So these were just some thoughts I had on.
No, that's really helpful and great reflections. And if I go to Joanna, who's got her hand raised. Joanna, did you?
Yeah, hi. Thank you, Lakshmi. That was very interesting. It's kind of, you were answering my question a little bit towards the end when you were talking about the methods, because you said at the beginning that you considered lots of different methods and you kind of settled on the cognitive interview. So I just wonder if you could talk a little bit about other methods that you considered, like the top few, and then kind of looking back, if you would have picked a different one, having found the challenges that you did with the thinking aloud.
Sure. I considered lots of group setting based, which I think in hindsight weren't very good, like focus groups and stuff like that. I also considered actually doing a survey and doing a quantitative study instead, where looking at kind of where participants would like rank choices and kind of list experiments, like where they would, how do I explain this? Well, they would answer the question, but then they would also like do a follow-up questionnaire, but then we would compare the two, essentially like just a quantitative survey approach. That was something I considered. I just considered having like just a general qualitative interview, but I think I wouldn't have been able to use some of the cognitive interviewing techniques in that. I also considered kind of sorting tasks. That's something you do in like survey design as well, where you would sort like different questions, group it. Like I didn't have time to get to it. That would have involved like more conceptual thing. I also considered concept mapping. That's actually something that I didn't like. I would have really loved to do that, because if you'll notice in my presentation, I looked at relevance and comprehensibility, but not so much at comprehensiveness, which is really about the conceptual aspects. So I think like having conceptual mapping to kind of understand how actually adolescents would define violence. We have defined it like this, but it may not be like really meaningful or universal to a lot of adolescents, to really work from the ground up how the ICAST should have been designed from the start or something like that. Sorry, I can't think of any more, but yeah, these are the ones I
That's
consider.
good, that's lots, thank you.
Yeah.
Brilliant. And we have one more question. So it says, how do you score this measure, thinking about the previous questions on culture?
I'm sorry, what's the question?
Just how do you score the measure? So how do you score the ICAST tool?
Oh, right. Oh, you're just, well, you just add it up really, actually. Well, I should check the manual, but you look at, if you haven't experienced the measure, you'd obviously not score that at all. You would look at exposure, then you would just look at, and then add the range. There's an average range for each of the kind of frequency measures. So you would just really add that up and you would get a total score.
Brilliant. So do we have any other questions? So if you do, please raise your hand or write in the chat box. No? Okay, I think we've answered all the questions, which is brilliant, and right on time, because, oh, hang on, there's one more question before we finish, which is a lovely question, which is, what's your next step with this program of research?
Oh, thank you. That's very nice. I need to publish the main 2 papers I have from this. I'm also planning to work up a revised version of the ICAST and also revise their manual for use, and it's available for, I think, very low cost with ISPCAN. So hopefully that should be disseminated to a lot of other researchers who can use this. I was also really hoping to write a kind of paper on like the methodological aspects. Ideally, actually, I really wanted to do the study with children and caregivers, actually adolescents and caregivers, but I didn't have the time or resources to do that. So if I had the time, I would. And I think as I was telling Joanna, I think also like to do that concept mapping study to ensure that actually the constructs that we are measuring in violence actually map onto what young people also think is violence according to them. Yeah.
Brilliant. And yeah, I'm sure we'd all agree that the methods paper would be very interesting. So I think that's a really good idea. In terms of the seminar, thank you everybody for attending today. And thank you, Lakshmi, for presenting. It has been a really interesting seminar. So thank you all. And I look forward to hopefully welcoming some of you at the next seminar and at our conference in March. So thank you, everybody, and see you all soon.
Definitely. Thank you.